All right, welcome everyone to another episode of the Dental Innovation Lab. Today I have probably one of the most special guests. He's my co-founder in a dental AI company called Trust AI, serial entrepreneur from the Silicon Valley. He came all the way from San Francisco to be here with us today. He's a really amazing person, and I can't wait for you guys to hear what he has to say. Everyone, this is Dr. Bernard Cass. Welcome to the lab.
Thank you. Thanks, Shervin. I'm really psyched to be here, and thank you for inviting me.
Absolutely.
Yeah.
So, first, I want to kind of get back into your, background of AI, right? You were coding when you were a kid. You are PhD in physics.
Yeah, correct.
And you have had a couple of AI companies already. So could you tell us a little bit about all that?
Yes, I'll jump into it. So I have a PhD in experimental physics. So my PhD was focused around creating microelectromechanical systems using X-rays in a synchrotron, which is basically a particle accelerator. So and I've also been studying quantum physics, quantum theory, and also computational physics. I mean, I've studied a broad range of topics when I was a grad student, and then ended up doing experimental physics. So now I'm an entrepreneur at heart. I actually founded and led several companies, both VC back and bootstrap. Mm-hmm. So my last company was Rio Intelligent Machines, which is basically a company focused on deploying AI-powered robots. So first of all, I raised over $100 million across my ventures, and also with government contracts and commercial contracts as well. So I mean, that one was a real success. We actually deployed robotic work cells from Florida to California, and now these robots are actually powering a broad range of manufacturing industries. And they're also, and then right now, at this point in time, they actually handle almost more than 50 million products.
Wow.
In the U.S. Customer products.
Very impressive.
Yeah. And then sort of prior to that, I found another company focused on imaging radars, like radar for autonomous driving. So this one, so I had a lot of fun into the autonomous driving space. So I pioneered the intersection of AI and robotics. So I've been developing technologies for the past 2 decades. I love deep tech. I love emerging technologies. So I was before founding my companies, I was actually at Xerox PARC, which is essentially like the Bell Labs. So they used to develop all sorts of technologies across the spectrum. So on my end, what I did, I was brought into Xerox PARC to form a new division called the metamaterial device and applications business area. It's basically applying materials knowledge to create new products out of it. So I was given seed money. I was given seed money. I built a number of labs, and I also commercialize products. So I've the sort of the top 3 products that I commercialized. The first one was a metamaterials radar. This is literally this one that I actually spun out of Xerox PARC to form a separate company. The second product was what we call self-cooling structures. So I developed like self-cooling paint. If you take any materials and you actually go outside, it will actually heat up. And this material, if you go outside in full sunlight, it will actually cool down. It's cold.
Interesting.
Yeah. So that one was sort of very groundbreaking as well.
Yeah, I know. I saw you're listed on 20 patents, and you were in the Palo Alto labs. I just filed my first patent, and it's not easy. So to be on 20 patents is really difficult. Takes time, and it shows that you're thinking ahead of everyone else. So, tell me, how you got into dentistry and why dentistry.
Dentistry is one of so. I'm passionate about technology. I always want to apply technology to solve real problems, and well, in this era, I mean, today we are in this AI boom where AI is actually the new electricity.
Yeah.
I was thinking about which areas can we apply AI right now that will differentiate us from sort of everyone else. I mean, if you look around, if I look around us, people take AI, but they jumped into customer service. I mean, that's what you see all around: customer service, summarizing emails. And I thought, well, what area is actually really underserved? And when I sort of and when I thought sort of deeply about it, and at the same time, it was maybe serendipity where I called my dentist and I wasn't able to get hold of her. And I said, well, I think this is one of those nice areas where we can actually really apply an AI receptionist. We can really apply AI to being the front desk of dental practices. And then when I started digging into dentistry, I realized that this is one of the, I would say, an underserved field compared to, let's say, medical. Like when you're technologists, it's like you don't really think about jumping into dentistry first.
Yeah.
Like everyone thinks, well, I'm going to jump into consumer products. I'm going to jump into, and if you think about healthcare, everyone says, well, I'm going to jump into medical.
Yes.
But dentistry somehow it's this niche area.
Yes. And it's always delayed.
Yeah, and then, well, sort of to cut the story short, I decided to build an AI receptionist, and I thought, well, I want to build something that's more than an AI receptionist as well. It's a receptionist is it's like the level 0.
Exactly. Yeah.
And then after level 0, we have I wanted to build let's say an AI co-pilot that takes control of the dental practice beyond being a receptionist, beyond front desk, and really into diagnostic and into dental treatment plan.
Yeah.
And then this is when, well, we actually met.
Yeah. Yeah.
We were introduced, and then sort of our vision aligned.
Yeah.
And you were expanded on that vision. I mean, that's how I did dentistry.
I sent you the patent, and then you read it. You said, it was like the fastest I've ever seen anyone read. It was like 50 pages. You said you read it 3 times. I said, I just sent it to them a couple of days ago. So. And that was when this was born.
Yeah.
The concept, just for the audience, is to automate the thinking behind what goes into looking at the data that's collected during a consultation and putting together a diagnosis and a plan. That's really the underlying. And with the data comes. You have the different sets. You have the X-rays, you have the photo, you have an intraoral scan, like a iTero type of scan, a 3D scan, a CBCT, and these data will go in to an AI and be able to analyze it to give this plan. I mean, it's, in my opinion, this is one of the biggest breakthroughs that will happen in dentistry. And we're creating it now. What's your take on all of this now that you're actually creating it? What are you seeing?
Yeah, and before I jump into I just wanted to mention one more thing. It's like I love when you said, "Hey, by the way, AI receptionist is already done." Like,
Yeah,
forget about it.
Yes,
Like,
You said you haven't. So how it happened is I looked at that, and I said, "Wow!" First, I said that this is amazing. What you created was really amazing, but I'm like, it's been there, done that. Someone else will do it tomorrow.
Yeah.
Right. And someone will do it in another field. It doesn't even have to be in dentistry. So that was the moment we kind of came aligned.
Yeah.
I just, was looking for someone, and you were looking for someone at the same time, and this thing was born.
Yeah, and you basically, scrap that. Let's move to level 1.
Yeah.
And this level 1 here is really what I would call an AI copilot that combines powerful diagnostic capabilities with dental treatment planning that enables real-time clinical decision making. So the goal here is to create to build a thinking partner for dentists. And that's the ultimate goal. And I say co-pilot, and if I want to dumb it down as well, it's the chat GPT that's purpose-built for dentists.
Yes.
And that is the goal. For dentists, I want to create this thinking partner where they can actually bounce off ideas. And why do we want to create it? I mean, fundamentally, it's what we call, it's a business fundamentally. We want to make dentists make more money. And the way we make dentists make more money is by, it's a three-pronged approach. One is we want to increase their productivity. Mm-hmm. We want to increase their credibility, and we want to increase the trust that they have with their patients.
Yes.
So increasing productivity is when we increase their productivity because now they can actually go through diagnosis and go through thinking way faster than before. Like all dentists will sort of at some point when they are faced with a convoluted case, they want to be able to call someone. Like we call another colleague, call a professor, and say, "What do you think about this case?"
Yeah.
And now they will have a thinking partner where they can actually that complement them, and they will be able to bounce off sort of ideas, and that to me will dramatically increase their productivity. That's one thing. And then the second piece here, and an example of this is it's for instance, if you have, let's say, a case where you have a fractured tooth with palatal swelling and periodontal involvement. So then you say, well, what should I do? Does the treatment plan involve periodontal crown lengthening with restoration, or should I go with an extraction and immediate graft with an immediate graft socket, mm-hmm. and with immediate
bone grafting.
Yeah, bone grafting. Yeah, with an immediate bone grafting and with the delay in implant placement.
Yeah.
So this is the sort of and now your thinking partner will tell you, will make you sort of rethink that. Yeah. Like you can go and sort of ask now the AI, what are the pros and cons for doing something like this? What are the risks? What's the clinical success of actually doing that? Yeah. And what additional tests do I actually need?
And the beautiful part is it has memory. So when they come back 6 months later, it has a memory of that patient where it can develop, and say, oh, the disease has not progressed or it's progressing fast. And you can give feedback, like this is maybe unusual, faster than normal. Maybe we need to intervene with the diet. We have a lot of sugar. Maybe you're not flossing. So it can catch these things and from appointment to appointment.
Yeah.
And also it's like you're getting a consultation with many different dentists or specialists and all at one time. Right, so this is trained by really thousands of cases.
Yeah, I'd say millions of cases.
Yeah,
and thousands of very specialized cases. So you're really getting like a professor next to you. So that's one. And then the second piece, sort of beyond sort of productivity, is the second piece is the credibility as well, because you have this thinking partner. You reduce the probability of making mistakes. Like because you have this thinking partner, you'll go with the what ifs. Mm-hmm. Yeah. And then what ifs, and then you arrive at a treatment plan where you essentially you've dramatically reduced the probability that you're actually making mistakes. So when you decrease the probability of making mistakes and you start doing that, then you earn credibility. And credibility means, it's more money. Yeah. Because if you think about dentistry, it's a field where it's word of mouth. Like, if there's a good dentist, everyone will know about it. And the reverse is also true. If you have a bad dentist who pulled the wrong tooth, they're never gonna have any business again. Yeah. So you increase the credibility of the person because you've augmented them. So you've increased their credibility, meaning more patients, more money. Yeah. And then the third piece is about increasing trust with the patient.
Yes.
Like, In many sort of, well, I would say in many cases, there's zero trust between the patient and dentist. Patients think, well, do I really need to actually do a root canal? Are you trying to max out my insurance, or are you genuinely trying to solve my problem? Like, is that really what?
It's that whole thing of, you go to, like 10 different dentists, you'll get 10 different treatment plans. and I think there was someone told me in the 90s, someone did that study where they actually did they got a different plan, and they said, well, let me continue this, and how many plans will I get different? And it was just kept going in a different plan, and the range was like from anywhere from 0 to like 100,000, something really, really wide. So trust is a big issue in dentistry, and I always see in social media comments when it's about dentistry, there's people that are upset that my dentist didn't see this, they overcharged me, they did this, they did that, and it's time, especially with this technology, that we can be able to standardize the brain, right?
Yeah.
We're living in a day and age where, like, during the Industrial Revolution, we magnified muscle, muscle fibers, so to speak, with cars and with machines. And now we're in a revolution where we're magnifying neurons in the brain. So it's time for dentistry to really, really catch up. So really thank you for what you're doing. You're gonna really make a change. So what other things are you seeing that could be improved?
In general, you mean?
In dentistry, as far as the landscape.
I mean, everything is very manual in dentistry. I mean, I had an opportunity to sit down in Devian's office, our common colleague, and there are lots of things that are very, very manual, like computing insurance claims, figuring out what fraction of the claim the patient has to actually go and settle. I mean, I saw that it was very manual.
Yeah.
And there are lots of things that the front desk is actually doing, and also, that's one thing. It's like, and speaking of insurance, it's verifying insurance information for patients. I mean, that's also very manual these days. Someone has to actually call in, stay on the phone, and then to simply verify that someone actually has insurance.
Yeah. How many modalities are there? So we have all of these different, X-ray scans. Are we able to create, add in saliva testing and different more blood tests, and to get more and more closer to this personalized treatment plan?
Yeah, definitely. Because treatment plan is actually very sensitive to various parameters. So when you look at the Copilot today, I mean, it takes structured input. So it takes the medical history of the patient, the dental history, the chief complaint, contraindications, whether the person has, even constraints on timing, whether it's financial constraints. So it takes all these input and then formulates a dental treatment plan out of it. So these are, it takes this holistic view and formulates it. And dental treatment plan is actually very sensitive to information. So if a patient, for instance, has diabetes, that affects the treatment plan. It will produce a different plan based on that additional information. If, let's say, the person is going for an IVF treatment, that also changes your treatment plan.
Yeah. So
it's very sensitive to those. So the more information that you can give, the better. And we had this conversation also with Michael Christian Coachman this morning.
Yeah.
And saying that this is also, so we need all this information because the treatment plan is as good as the information that you're getting.
Oh.
In computer science, it's called garbage in, garbage out. So if you feed it garbage in, you'll get garbage out.
Yeah.
So essentially that's what's happening. So the more information that you can feed if it can pull from again, it's like CBCT scans, saliva tests, blood tests. If you can aggregate all this information, then you're feeding in. You're not feeding in garbage. You will take all this into consideration and formulate the appropriate one, the appropriate dental treatment.
Yeah. And I think we're getting better and better data, access to better and better data. That's the hard part. Right, because you need tons of it. You need a lot of it to be able to train these models. What do you think in general from that you're seeing and just in AI as far as all of the the DeepSeek versus ChatGPT? I wonder what your take is on what's going on and.
Yeah, I mean, in a nutshell, this field is moving really, really fast, and everyone is sort of piggybacking on other players.
Mm-hmm.
Yeah, DeepSeek is another phenomenon. Well, it actually came to light these past few days simply because it took less than 6 million to train a system that's as good as the O1 from ChatGPT, which essentially took hundreds of millions of dollars to train. I think really, I mean, on aggregate, if you look at all these foundation models, I mean, it's billions of dollars that were used to train them. And now, I mean, the great thing about, it's great it's great for everyone else, but maybe not so great for foundation model companies. It's because now for the others, it's great because we know it's like DeepSeek has proven that it's possible to train a system without spending billions of dollars.
Yeah.
And I think they also made it worse for the foundation model companies by open sourcing everything. So they open source their platform. They actually released it on an MIT license, which allows anyone to essentially take it and make it commercial. So now essentially it's like now you can have a system without going and paying OpenAI. You don't have to go and pay these big companies that raise billions of dollars. Now, for them, they're in panic, and their investors are in panic because their investors invested billions of dollars.
Yeah.
Now, the investors are basically saying, how can I recoup my money, my billion dollars now?
Yeah, I heard this interview a couple of days ago. Really someone I respect in the AI, computer science world. He was saying that if anything, it's validating these higher valuations, and it's the valuations of these open AIs aren't going to go down. And I wanted to know, why do you think he said that? And because the next day after that, I saw SoftBank came out and gave a valuation, investment at a $350 billion valuation for OpenAI, which is pretty huge number, especially after the week of the news.
Yeah.
So it's being validated. It's not these valuations aren't going down. NVIDIA's 17% drop that one day was actually, a healthy correction in a way, because it was very overly valued. I still think that's a good buy in the long run, because they have, there are all these other companies that come about. They're going to need the chips, and they have the chips.
Yeah.
So NVIDIA is only going to go up from here. If anything, that was a good opportunity.
Yeah.
So I thought that was really interesting how they said that it won't affect the foundation companies. It's actually going to help validate it. Do you have any comment on that? Because it kind of took me back.
No, I mean, a couple of things here. Valuation, they have to maintain a healthy valuation so that these companies can continue to exist. Like investors, in general, when investors have poured money in a company, they don't want to back out easily, because now they're vested per se.
Yeah.
Like you've injected $1 billion, so and because. So OpenAI is burning, I don't know, like millions of dollars per day.
Mm-hmm.
So it needs to continue to burn that money so that they can still provide those the foundational model. Like they are getting a large user base.
Mm-hmm.
They need to navigate around how they can recover or how they can actually go and make it profitable at some point.
Mm-hmm.
So the United, well, everyone else, whether it's the United States, the United States as a whole, United States government and investors, they actually want to maintain that. So they are not gonna they're not gonna scale back the valuation of the companies.
I see. Makes sense.
I think it's because you're being invested, you're not gonna throw everything out there.
Yeah. That's true.
And you said, well, and also, so you're not going to throw everything out the window. You have a competitive advantage as well. And then OpenAI, what they are basically doing, like today they released the O3. And probably also because of all the DeepSeek pressure. They wanted to show that, well, we are injecting that much money. And because we are injecting that much money, we can still produce models that are better than what's out there, than the DeepSeek model. So today they actually released the O3. Mm-hmm. And this is what Sam Altman mentioned on his Twitter feed. It's like, well, we are going to continue to build better and better models. And we are actually going to validate that, hey, you can't really go and circumvent that, circumvent the fact that you actually don't need a lot of money.
Yeah, got it.
Yeah, and then also, I mean, if you followed the news, now they have built something, a ChatGPT that's tailored for the government. Mm-hmm. And that's huge. That's why these valuations are not going to go down, because now they've said, hey, by the way, now we have a ChatGPT that's tailored for the government.
What does that mean for the government?
Oh, that means that you'll be able to handle classified information and everything.
Nice.
It's
more private.
Yeah, more private on private servers, private AWS, and the information is not going to go back to OpenAI, and they won't train their systems on it. And then because it's tailored for defense, so you can craft it for war.
So is ChatGPT right now taking information from users and and they're training off of?
Yeah, it does tell you if you want to opt out. Like you have this like temporary chat. If you say, I want a temporary chat, they will say, okay, your data, this is going to be temporary. Your data is not going to be used to train our models further. But otherwise, if it's a normal chat, yes, they are.
Interesting.
Yeah. You can. I mean, they've made it easy now to opt out. You can actually go and opt out and say, I want all my chats to be temporary.
I think I did that. Because one time I asked it, is what I'm writing, are you training off of it? And they said no. I said, are you sure? Are you 100% sure? They said, yeah, well. And so I don't know. Who knows what to believe, and you have the DeepSeek also. The information is going to China.
Yeah, DeepSeek itself, yes, because it's hosted on Chinese servers. So right now, what people have done, I mean, the fact that they've actually released it, they've made it open source and they've released it under the MIT license. A lot of companies have taken that source code and then released versions of DeepSeek. So we now have a lot of a couple of versions of DeepSeek out there that's hosted primarily on Western servers. So you can actually use that sort of, without concern that your data is actually going to go.
I'm going to get very, very DeepSeek here, deep. So let's say someone puts their, medical information, their blood tests on there, their genetics, their 23andMe, on DeepSeek to analyze it. If it get analyzed and if they see, the genetics and the pattern, maybe they're able to create a virus, let's say, send it out into the world and knock out like the genetics of a country. It's possible.
It's possible. Everything is possible.
Make for a good movie, but at the end of the day, a lot of these things that in movies end up being possible.
Yeah, and people are actually doing that, by the way, and especially with Grok, the Grok with a K, Elon Musk company.
Mm-hmm. Yeah.
So Elon Musk, at some point, encourage people to dump all sorts of data about themselves on Grok. So you have medical data on Grok. You have X-rays and...
Yeah. And I think that's really interesting, something to look out for and be careful for, right?
Yeah.
So tell me more about, we're trying to create this AI treatment planning, being mindful of the mouth-body connection and really tie everything together. What are the kinds of issues that we're able to find and make easier for doctors to be able to see faster? What kind of correlations and
I think you're the
okay. Okay. So something that I'm seeing is that we're able to see, like for example, with sleep and grinding.
Yeah.
We're able to see, for example, if someone does have a medical history of something, for example, some immune-compromised issue, diabetes, maybe they're when their vitamin D levels are low, it's going to say, do not perform surgery until you boost it up to, this is the minimum that we're seeing for better recovery.
Yeah.
Right now they're saying, like, for example, don't do dental implant when it's the A1C number is at 8.
Yeah.
Maybe we find out it could be 7.8. Maybe it could be 8.3. We don't know until we all of a sudden start seeing this AI being able to find out what's happening. So imagine we have this memory, and then all of a sudden we see it has all this information, and we type in the implant that we placed for this patient failed. And then it has a memory, captures that, and then someone else puts that in. And then now we found this new correlation that because it's, during the winter, we're seeing more failures because the vitamin D level is lower because people aren't getting enough sun. So during the winter, you should supplement with vitamin D if you're getting a dental implant. Things like that are going to be able to be seen now.
Yeah, exactly. I mean, it's going to be able to do these kinds of cross correlations between it's like the body and the mouth.
Yeah, exciting. We had another podcast with a smart night guard that we talked about something similar. We're going to be able to have that kind of data also to put in, so we can get information on their sleep habits, and correlate that with their grinding also, and then now put it all together and have an even more comprehensive view of their oral health. Dr. Christian Coachman, he had a very beautiful word that he really created for what this new kind of dentist is going to be, and he calls it an integrated oral physician, which I really love because it describes the direction that the role of a dentist is becoming. And dentist is dentition, is teeth. It just allows you to just look at that one thing and focus on that one tooth, that white part, when there's so much more than the white part. You have the pink part, you have the bone around it, you have the blood vessels that are connected to the heart, and you have the palate and the shape of the bones, and the anatomy, the sinuses. You have so much more than just dentist.
Yeah.
So I think that nomenclature defines sometimes our personality and how we think, and I think that word is a good way to also let patients know that we are a little bit more than that. We know more than that. We could help you with more than that. And now we're going to be able to have many, 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 dentists, not just the dentist, regular dentists, not only general dentists. In this consultation, we're going to be able to have all the specialists, maybe 50,000 specialists in this one room with us right now. Let's push this button and see what they say. Now, doesn't mean we're going to go and 100%, we're going to follow that, but it's a guide that tells us that this is something that the average would maybe go and want to do as a plan.
Yeah.
Having said all that, how do biases fall into all of this?
It will, but it depends on training. I mean, that's why you have to train on a variety of sources, so that you don't specifically say, if you train on one single source, then it's going to introduce some bias.
Yeah.
Yes, it needs a diversity of sources, and it also needs to create itself. I mean, a little bit like DeepSeek has done. It's like it creates own synthetic data in dental cases and it start training. So by creating its own data and acquiring from a diversity of sources, you are actually slowly removing the bias. But I want to also mention that this is a thinking partner. What we say, I repeat, it's a co-pilot. It's not a replacement for a dentist.
Yeah.
And whether it's, well, sort of this AI or other AI, we shouldn't trust it blindly. Like, we should look at the recommendation, use it as a thinking partner, and then, well, think independently. Because at the end of the day, the accountability is not on the machine; it's on the person. It's not the reverse. The machine does not become the dentist.
Yeah.
It's or otherwise. I mean, I think we have deeper issues if the machine is actually becoming the dentist. But we have to take it and every AI systems today will have some sort of a disclaimer. It will tell you AI can make mistakes. Like, you really need to verify what it's actually spitting out.
Yeah.
I mean, it's the same thing there. It's like, and also if you have a colleague and you're asking a second opinion with a colleague, we should also double check. Like, it's not because it's a colleague that you should blindly accept the second opinion.
It's true.
And if it's a convoluted case, even if you ask the AI, you should probably ask another colleague a second, third, or fourth opinion before actually coming to a conclusion.
Yeah, that's a good point. If it might hallucinate, it might be off.
I don't think it will hallucinate. Purpose-built do not really hallucinate. If you feed in the right information, the ones that hallucinate are the ones that are not purpose-built. They are general systems.
Mm-hmm.
So, I mean, we had cases like these where, I mean, like in 2023, Stephen Schwartz, it's a lawyer. He used like ChatGPT to actually go into court and to be able to defend his position. So ChatGPT came up with fictitious legal cases. Mm-hmm. And then he went in and cited case X that, never existed. When the judge tried to verify these cases, they found out that, these cases never existed.
Made up, yeah.
Yeah, they were all made up. And every one of them were fined $5,000 for actually doing that.
Wow.
But that's a general system. It can hallucinate, but there are systems like Harvey. Harvey is one of those legal AI system or model where it does not really hallucinate. This one is actually trained, purpose-built. It has what we call RAG, retrieval augmented generation, so that it has guardrails so that it will not make up any case. It will not veer around and do that. I mean, it's the same thing here.
Yeah.
When we have purpose-built systems. They have very, very specific guardrails. They will not go outside that. Yeah. And we've seen that when we want to talk about a specific case, it will tell you. And you've heard when when we were actually conversing with it, it says this is actually not in the report.
Yeah,
like this thing is not in the official report. It's not in the case. But I'm still gonna answer you. But I'm just warning you that we are going slightly outside that boundary.
Yeah.
So they will not hallucinate that easily because we have implemented a lot of guardrails around that. Like really purpose-built, fine-tuned system do not hallucinate. General system, yes. And that's why general system, you can't use it for things that are critical, where people's lives are at stake.
Yeah, that's true. So what you're saying is if it doesn't know, it'll say it doesn't know. Or if it doesn't know, it'll say we need more information.
Yeah.
Like recently, when we used it, it said, we that input wasn't put in. Like, we don't have the patient's medical history, so can't tell you.
Yeah.
We asked about orthodontics. It didn't know. It didn't have a picture of the teeth, so it didn't know if the teeth were crooked to give a recommendation on that.
Correct. Yes. And I've seen Devian also call test drive our sort of system and ask, you will say, actually he said something like, I think the patient smell like marijuana. And the system said, this is not really in the file here. And we can try to give some recommendation, but it's not in your in the file.
Should we do so I definitely think we should do a little preview of what this AI can do and how powerful it is and what a big difference it can make for people's dentist lives.
I didn't see.
as far as just a overall question on AI in general, the direction we're going, right? So you're a robotics person as well. Are you? I think you're the most. Dentists always say, "Oh my God, am I gonna have a job?" People are always freaking out, and you hear comments all the time. How many more years until I don't have a job? You always hear that from dentists.
Yeah.
Do you think that there will be one day that that dentists will get replaced by robots?
That would be sort of very, very far out. I wouldn't say replace, because you still need to do a lot of things that are physical as well. Like the machine, behind the machine, you actually still need a human operator, and you will continue to have that for a number of years.
Yeah, you can't just
at least for a decade.
There has to always be someone there.
Yeah. And they're always, these systems at some point also, even physical systems have bugs. Like we build machines that go into factories, but for large factories, we actually created new jobs by creating a position called a robot operator, where essentially a person would come and live in the factory and basically attend to all robots during the day. Like that would be like the go-to person.
Yeah.
So the robots themselves didn't completely become autonomous and started to replace people. And because also while they interact with people, people tend to break them as well. So yeah, this is not gonna go away. But what will happen is that jobs, jobs will be, I wouldn't use the word eliminated, but transformed. Yeah, it's like certain jobs will no longer exist, but other jobs will exist on top of it. Like, for instance, like the robot operator. Like, in the future, you would not, in a dental office, have a pure receptionist, for instance. Like, if a receptionist does the whole day's answer phone calls, that job will become eliminated. But if the receptionist does something else beyond, anything that's sort of physical as well, in the office, they'll still have a job.
But that, the human touch, right? The warm smile when you walk into the dental office. Can I get you some water? How about that? Is that replaceable?
It depends on who you ask. Like the company Robotics at CES this year, they produce an AI girlfriend that can actually go and smile. So they anticipate that these things could be replaced in the future. So for $175K, you can buy an AI girlfriend.
Oh my God, that's crazy, crazy world.
So and then there are also companies developing emotions for machines, like smile, facial expression, and now there are emotion modules as well. So that when let's say when the AI talks, they can actually inject emotion.
I see.
And now there are also modules where they can recognize the emotion of the other person. So they can recognize when you're angry, when you're sad.
Yeah. But that's good to hear that dentists will always have a job.
Yeah. I think people who are very specialized will always have a job.
Yeah.
Yeah, and then also the new generation right now. Everyone growing up now is becoming more and more digital.
Yeah.
So they will blend in seamlessly with a new world.
Yeah. Yeah, I agree. I'm of the same thinking. Yeah.
Yeah, it's like everyone, even little kids right now, they know to sort of maneuver on an iPhone.
Exactly. Yeah.
And my son sometimes comes in and shows me stuff that, I didn't know about.
Yeah, that's true. Yeah. So I found this. Let me play it for you guys. All right.
How can I help you today?
I'd like to speak about Sarah Logan.
Based on the expert report, Sarah Logan has a fractured tooth with palatal swelling and periodontal involvement. The primary recommended treatment is extraction with immediate socket grafting, followed by delayed implant placement. This approach is considered comprehensive due to the severity of the condition and aims to provide a predictable long-term outcome. Is there anything specific you would like to discuss about her treatment plan?
Yeah, I'm concerned that if I do an extraction an hour, I'm going to need to do sign it later in the future. How can I make sure I maintain as much vertical bone height?
To maintain as much vertical bone height as possible during an extraction with grafting, it's important to focus on preserving the ridge dimensions. Immediate socket grafting helps maintain bone volume and supports future implant placement. Using a well-integrated bone graft material and ensuring proper soft tissue closure are critical steps. Additionally, evaluating the need for a sinus lift through a CBCT scan can help plan for adequate bone height maintenance. Would you like more information on managing this aspect of the procedure?
No, what's the best way for me to age my stitch structures to know that the palatal cusp is going to come off quite far down on the root?
To perform an atraumatic extraction, especially when the palatal cusp is fractured far down the root, consider using periotomies or piezosurgery to sever the periodontal ligament gently. This minimizes trauma to the surrounding bone. Sectioning the tooth might be necessary to remove it in fragments, reducing the risk of further damage. Additionally, careful elevation and rotation can help preserve the bone structure. Ensuring the patient is well informed and comfortable throughout the process is also crucial. Would you like any additional tips on this procedure?
I use oxygen implants. What's the evidence to show that some of these graft materials do not require membrane, you just suture over the top of them? Is that still a good grafting material to use in this situation?
Based on the expert reports, some graft materials, like oxygen plugs, are designed to integrate well without the need for membranes. These materials often have properties that promote tissue integration and maintain space for bone growth. Clinical studies suggest that certain graft materials can effectively support bone regeneration when sutured over directly, especially in cases where primary closure is achievable. However, the decision to use a membrane often depends on the specific clinical scenario, such as the size of the defect and the quality of the surrounding tissue. It's always best to assess the individual case and consider consulting current research or guidelines for the most up-to-date practices. Would you like more detailed information?
So, just a little, on what it's doing. The input on that was basically a treatment plan, right? So this was looking at an X-ray, looking at medical history, symptoms, clinical scenario, and then it's able to take that information, analyze it, and answer almost any question.
Yeah, it can actually answer almost any question. So it'll take all this input, and in the future, it's gonna take inputs from your PMS system, from healthcare external healthcare records, and then piece everything together.
Yeah.
And also, yes, then it generates, based on this, it generates a treatment plan. And then now after that, you can have a real-time conversation with it. It takes, so we can generate, we could, but the way we actually do that is generating the treatment plan takes about a minute or two. So usually you don't want to really have a phone conversation if you have to wait for a minute or two. So that's why it's sort of pre-generated. Like you input your case, it generates it, and then it's like, then you can have a real-time conversation about the case.
Yeah.
And then you can ask, various questions. Even if you deviate, it will tell you, you're slightly deviating, I'm still going to answer it.
Yeah. Amazing.
Yeah, and you can ask a lot of things, like what are the alternative procedures? If I wanted to be conservative, for instance, what's the dental treatment plan they would have recommended? If I want to be minimalist, or if I want to consider aesthetics. For aesthetics, you need to input a little bit more information, but you will tell you. You can say, what are the risks of this procedure? What are the pros? What are the cons? What's the clinical success that people have achieved with us?
Yeah. And I think people wanna know the research also behind it. Want to hear the reason why behind something. Like, why are you recommending this option? What are the other choices, alternatives, risks, benefits? Also, the patient is going to be looking at some of this, and they could look at it and get reasonings behind certain things. I think this is going to be amazing. I'm so excited for this. Is I think one of the most important things I've ever worked on in my life, and I'm happy to be working on this with you at this moment. It could only be in this moment because this is when the technology is allowing for it. The landscape is just exactly the right moment or right time.
Yeah, it's green now.
And going back to the name of the company, the trust AI, that the trust has needs to come back into dentistry. To really, I don't want to look into the comment section of and hear and see these, horrific stories and this bad feeling that people have towards dentists, and think of them as like a mechanic, or they're just, they opening up a hood was like their mouth, not knowing what's going on in there, just praying that the dentist is doing everything the right way. I think those days are numbered.
Yeah.
So with that, anything else you want to finish off on?
Yeah, I think, well, first of all, this is the first of its kind. There's nothing like this out there. I mean, we literally built the first purpose-built AI co-pilot that handles dental treatment plans. And of course, and if anyone wants to sort of test drive those, they're welcome to get in touch with you. And we'll proceed from there. One thing that I actually wanted to add, since you actually mentioned trust again, it's you can actually call the system and say something like, "Hey, by the way, I have the patient right now in front of me. Like, okay, patient Sarah is here. Can you explain to her? She's not a dentist. Can you explain to her what's going on and what type of procedure we are thinking about, and let her ask real-time questions about it."
Interesting.
So it will immediately switch the language to a layman's language and explain it.
That's
like, you can switch between, if you're a dentist, you're a specialist, you say, well, we will go full swing, full blown on the lingo and jargon, and it can also switch and dumb it down completely.
Yeah. Amazing.
So that creates more trust if you can have, let's say, a patient ask the question directly and say, okay, what's happening in my mouth? What is the sort of the dentist here thinking about?
Yeah.
What are my options?
Or even a step further, when they go home and they have questions, they can somehow connect with the system.
Oh yeah, definitely.
Still ask their questions and get answers.
Yeah, correct. They can still call and you will have a 24/7 specialist at your fingertips.
Exactly. Well, thank you so much for coming over here and having this conversation. And I hope you can come back for more of these once we make some progress and actually hit the market. Yeah. And I'm excited for the future. So thank you so much.
I'm very excited as well. I mean, I was psyched. Thank you very much for the
Thank you. Awesome
invitation.
All right, everyone. Thank you for another amazing episode at the Dental Innovation Lab. For next time, we'll see you guys hopefully very soon. We're releasing these once a week, and we'll see you then. Take care.